Health coverage is a global system that ensures the provision of healthcare system and financial protection to all citizens in the country. In Nigeria, however, the system covers less than 10% of the population, and the government is aiming at achieving 30% coverage by December 2015. How that can be achieved is the issue I discussed with the Executive Director of the National Primary Healthcare Development Agency. Hello, welcome to the program. I am Omelogo Nnadi. The universal health coverage holds the key to unlocking the door for equitable, qualitative, and universally accessible healthcare for all Nigerians without suffering financial hardship. This week on the program, we'll be focusing on the universal health coverage. There is also a special report on Gishiri community where there is no health facility. But first, the federal government has expressed commitment to the provision of healthcare services in Nigeria.
Considering the overwhelming global support and documented benefits of universal health coverage, the federal government is taking the bull by the horns to ensure easy access to healthcare by all Nigerians. At a pre-summit conference on universal health coverage, the Minister of Health restated the government's commitment to improve the nation's healthcare delivery system.
The theme, USC, the Vehicle for Sustainable Growth and Development, captures government's belief in the centrality of a healthy population to the President's agenda. Health is a top priority for this government, and we have continued to engage widely to find solutions to our health system challenges, as well as invest strategically to improve access to healthcare at all levels.
A health financial specialist from the World Health Organization identified poverty and weak health systems as factors militating against universal health coverage.
The top end of the bar actually shows the average of the highest quintile in that country, whereas the lowest end of the bar shows the average percentage of the lowest income quintile. So this enormous inequity is quite worrisome, apart from the fact that we see that millions miss out actually needed health services. The percent here attended births by skilled health workers.
At a separate event organized by the African Health Journalists Association, malaria and typhoid fever were identified as the biggest health concerns of Nigerians.
Cost may be a deterrent in seeking preventive types of care, so that people who interact with the health system are just doing so when they must or when they have to. And then the big reason that you're here, what is the priority health concern of Nigeria? Well, they ranked malaria, as we were just talking about with Dr. Idogo, they ranked malaria and fever as the most important health challenge they face.
The presidential summit, to be hosted by President Goodluck Jonathan, is aimed at fashioning ways through which healthcare services can be brought to the doorsteps of all Nigerians.
Joining me now is Dr. Ado Mohammed. You're welcome to the program.
Thank you very much.
Let's start this way. Could you tell me what the universal health coverage is all about?
The universal health coverage is a strategic approach towards ensuring that quality care is being provided for a population without the challenge of having to, the physical challenge that comes with paying for services. So it seeks to actually provide services services are qualitative, and also we're taking care of the financial burden that comes with limitation to people accessing service.
When was this universal health coverage introduced? I understand it's been about a decade now.
Yes, it's a globally it's been more than a decade that is being conceived, and quite a number of countries have attained that universal coverage. As that last week, about 50 countries have keyed in, into the that approach to delivery. We in Nigeria believe that we have to come on board, not only in terms of providing services for our people, but also it will fast track our efforts towards attaining the MDGs, because it's all encompassing.
About 10 years running, we still have out-of-pocket payments in hospitals. What are the challenges exactly?
It's not as if Nigeria have not been implementing universal health coverage, because we have several initiatives that are ongoing. Because as I said, it's a comprehensive package. So what we're doing this time around is just to galvanize the whole stakeholders into coming on board, because it's a movement. So we wanted to carry everybody along in terms of ensuring that I will address the three key components of universal coverage, which has to do with physical access. You just mentioned the issue of paying out of pocket expenditure, which is huge in Nigeria. About 60% of health expenditure is out of pocket. So we're trying to address that, and as you're aware, through the formal sector health insurance scheme, about 3 million Nigerians have enrolled, but we believe that it's incomplete because the formal sector alone cannot take us there. So we need to bring the informal sector, we need to bring in the vulnerable group, we need to bring in the pregnant women, the unemployed, and then the age.
But hasn't this been happening for the past 10 years? Haven't you been bringing in all these stakeholders, all these groups?
There are three components, as I said. So we've been implementing quite a number of initiatives in country, but this time around we are galvanizing it into one in such a way that we bring in private sector, because government alone cannot provide that. And one key component of the universal health coverage, which has to do with removing financial barrier to accessing service, is a component that presently the NHS is addressing. And from the summit, I'm sure you must have heard that we intend to, within the next 1 year, enroll 2.24 million school children.
We're going to get to the issue of the declaration arising from this summit later, and then also the issue of the NHIS. But you've been mentioning at least 3 times already, you've told me that government alone cannot do it. We know. But one of the key things that must be done is budgetary allocation. What is the budgetary allocation, percentage of budgetary allocation to health as we stand today in Nigeria?
I think we should go beyond these percentages. I think we should be looking at allocative efficiency. Allocative efficiency is in terms of bringing return on investment. If you are given 1 naira, another person is given 1 naira. It shows, how efficient are you with that in terms of saving lives? For us in the health sector, in the agency, what matters most is saving lives. So we measure our expenditure based on the number of lives saved, and then the number of children that are immunized. So that is the kind of results. So it's a result-based budgeting process that we're carrying out now. So and looking at that, there is nowhere in the world where government alone can cater for the health needs of any population. So what we're doing with universal health coverage, for example, a key component of the universal health coverage has to do with supplies. And supplies include ensuring that you tackle the issue of geographical access, so that in every location, any Nigerian resides, or any person in Nigeria, you can walk freely within 5-kilometer radius, and you get access to functional primary care center. We have about 10,000 political wards in this country. We have more than 16,000 primary care centers. But because of equity issues, some wards have 3, 4, some don't have any. So we need to address that issue of equity. But government alone cannot provide all the primary care centers in terms of functionality. So we're bringing on board private sector providers to also come on board. But let's also not forget the fact that state government and local government have a very important role to play.
Yes, talking about government commitments, let me look at financing health in rural areas. Why has there been a challenge in this?
The responsibility of primary care provision is that of the local government, with the state government providing supervision and guidance. What we do at the federal level is to provide guidance in terms of policy direction, in terms of stewardship, in terms of coordination, and monitoring and evaluation, also resource mobilization. But looking at the architecture in terms of the government structure, you have local government, you have states, you have federal government. The local government, primary care is the cornerstone of our health policy, is the backbone of our health system. And this is a major aspect of health system that is being saddled to a level of a tier of government that one can say